Good morning. I'm Patrick Erickson with the Inland COVID Response Joint Information Center. We appreciate everyone for being with us this morning for our daily briefing. Now, this morning we'll have an update from Kelly Hawkins with the Spokane Regional Health District. And this morning we also have officials with the Mann-Grandstaff VA Medical Center, along with the Washington State Department of Veterans Affairs. Now, as always, if you have any questions for any of our speakers, please share them with us on Facebook, and we'll get to as many of those as we can this morning. With that, we will start with Kelly.
Good morning, everyone. Today, with our numbers, we have 375 cases in Spokane. That's up of one from yesterday. We do, unfortunately, have an additional death. Our count is now at 23. We had a gentleman in his 70s who recently passed away. Our hospitalizations, though, remain at 66, and we have 10 still currently hospitalized. Joining us today are representatives from our veterans community and organizations. Their partnership during the COVID-19 response has been very instrumental to our community's fight against the spread, not only with collaboration during medical surge planning, but also because of the much needed support and services that they provide our community, especially during these unprecedented times. So with that, I'd like to introduce Brett Bowers with the Mann-Grandstaff VA Medical Center.
Good morning. It's nice to be with you today. Thank you very much, Kelly, and to Patrick. And on behalf of our entire team at Mann-Grandstaff VA Medical Center, it's a real privilege and honor to be here. I want to give a quick shout out to all the veterans and all the people who love and serve veterans in our region-wide community. We're so grateful for that support on a regular basis. It is Public Service Recognition Week, and that's one of the reasons why we're here, but we'll get to some other things in a few moments. But Public Service Recognition Week, many thanks to Spokane City Fire Department, Jamie McIntyre, all the people who brought such good spirit and cheer. We were lucky as our medical center out in Northwest Spokane to be one of 4 that welcomed in this wonderful parade for healthcare workers by all of the emergency responders. It meant a great deal for morale. It was a huge pick-me-up, and it was just proud to be a part of the whole community-wide effort in this COVID response. We also want to thank the hard work by the Spokane County Emergency Command Center, the Joint Information Center. We've been staffing that for well over a month with Mark Sheldon. He's an RN. He is a nurse by trade, obviously, and most of the time you might have found him on our mobile medical unit, but he has been here with the operations folks on a regular basis for over a month now, and it's been instrumental to the collaboration and partnership that Kelly talked about a moment ago. We also want to give a huge shout out to all of our other healthcare partners and our regional veteran partnerships. Some of you will hear from today, including the Department of Veterans Affairs for the state of Washington. Looking forward to having Rudy Lopez speak momentarily. We also have some friends here from the Vet Center in the Spokane Valley. They're going to tell you what they're doing during this COVID-19 pandemic and how they're helping with all of the veterans in need in our community right now. We want to give a shout out to the Spokane Regional Health District, certainly the Department of Health, and our community partners, the other hospitals in this region that are doing all the best that they can, and in some cases even helping us with supplies and a collaboration to make sure that we get through this, because that's our real goal. It's also National Nurses Week, so we got to give a shout out to the nurses that are doing their very best right now, caring for all of our loved ones, regardless of the illness that they may be impacted with. And I can tell you right now, at the VA Medical Center, where I work every day, and I'm proud to be there, we have nurses caring for 34 patients right now from the State Veterans Home, and 31 of those are COVID positive. And our nursing team is down in Building 12, which was formerly our Community Living Center, and they are doing an outstanding job. Some of them are in their PAPRs and PPE for 3-hour stretches, dealing with these very ill patients. So I want to give a shout out to all the nurses, wherever you may be. We couldn't do this without you, so that's why we got to give a little plug for National Nurses Week. We do want to point out that we are pretty proud of the fact that we are the facility that has these COVID patients under our care. We're working very hard with our other partnering facilities who are also caring for these COVID positive patients. It's a stressful time, but we've been at this for 2 months preparing for this medical surge. I have some experts here with me today that are prepared to talk a little bit about the difficulty and the challenges with that. One of the folks that's going to talk with at the end of this, who might answer a question or two, is Sam McComas. He's a registered nurse. He is our Chief of Quality, Safety, and Value, and he is also our Deputy Incident Commander for this hospital and medical surge operation. Right now, I do want to say that I'm happy to present, and the reason why we're here is because May is Mental Health Awareness Month, and VA certainly is very supportive of that effort. We have an entire team here in Spokane who is dedicated to improving the lives of our veterans and whatever mental health that they may be experiencing, whether it's a challenge or whether things are good or maybe they need some help with some things. And to do that today, I'm proud to introduce Dr. Sarah Auslan. She is our Interim Chief of Behavioral Health Service at Grandstaff VA Medical Center. She has 11 years experience as a clinical psychologist, and she has earned her undergraduate degree from Washington State University. She earned her clinical psychology degree from the University of Texas Southwest Medical Center in Dallas. She oversees a staff of 140 mental health professionals working every day, not only at the medical center, but she's going to tell you a little bit about our reach out into the community and how influential and impactful that is on the lives of our veterans that were in our care. She's here to emphasize how she and her team are dedicated to doing this every day. So thank you very much, and please join me in welcoming Dr. Sarah Auslan.
Thank you, Brett. Make this my height here for a second. Just apologies to the next person behind me. Thanks for having me. As Brett mentioned, May is Mental Health Awareness Month, which brings us here today. Now more than ever, we recognize the importance of mental health services. During this time of sheltering in place, economic uncertainty, and changes in roles for people, we're seeing that even people who never had mental health concerns are needing additional support from us. Over the past 6 weeks, I've been impressed by how this entire community has come together. At the VA, we've ramped up our efforts to reach out and provide support at a level we've never done before, using relatively new technologies. It's really been an all-hands-on-deck mission. The Behavioral Health Service of the Grandstaff VA has continued to provide mental health services to our veterans during this time. In fact, compared to the same time last year, we've provided more visits to our veterans. What has changed the most for us is the way in which we provide these visits. The majority of these have used technology such as video into the home, secure email, and of course the good old-fashioned telephone. We were fortunate at the beginning of this to have the infrastructure and training in place to be able to jump in immediately and provide more virtual care. Every one of our clinicians was already trained in how to use the VA Video Connect, which is a secure FaceTime, if you will, to provide care. What we've seen over the past month is a 1,500% increase in our video visits and an almost 500% increase in telephone visits compared to the same time last year. We have still continued to have a physical presence at the medical center to provide face-to-face care when absolutely necessary, while maintaining all the necessary CDC recommended precautions regarding close contact. What we've learned from this is that video technology opens up a whole new avenue for reaching those who need it. My goal moving forward is that we continue to leverage these technologies and reach as many people as possible. Our suicide risk management efforts remain strong. While outreach events that we typically attend have been canceled, we have increased our efforts to reach out via mailings to our veterans and providing local gun shops and pawn shops with gun locks that have the Veterans Crisis Line to give to our veterans. Every chance we get, we're making sure people are aware of the Veterans Crisis Line. And giving myself another opportunity, that number, for those who don't know it, is 1-800-273-8255, and then press 1. In addition to serving veterans who we would typically see, we've also been assisting other departments in reaching out to veterans not necessarily engaged in mental health services. We have really been trying to get creative and expand who we help. We have several staff members, including our voc rehab specialists, peer support specialists, and integrated care psychiatric nurses reaching out to primary care patients just to say hello, remind them of the recommendations for limiting exposure, and asking them how they are doing. We consider this a proactive way to reduce the potential for loneliness and social isolation at this time, offer a friendly message that we care and that we're all in this together. The response has been overwhelmingly positive, and we heard from veterans that they appreciate the additional contact. Additionally, our peer support specialists developed early on an employee coping resource guide for our colleagues during this difficult time. We received such positive feedback that, working with the suicide prevention team, we developed a similar coping resource guide, which was developed for our veterans. We hope to have this up in the next couple of days for people to easily access. It's really trying to pull everything together in one place to reduce the feeling of being overwhelmed. Additionally, the National Center for PTSD recently released a COVID Coach app, which can be found at the ptsd.va.gov website. I downloaded it this morning. It's a great resource guide, and I encourage everybody to do so. You don't even have to be a veteran to access it. While this time has been difficult and a humbling experience for many, it has caused us to step back and look at how we can support all of those around us, because we're all in this together. No one is immune to the struggles associated with this pandemic. We're social beings, and the necessity to physically distance at this time makes it particularly challenging for most. As we kick off Mental Health Awareness Month during this historic time, my hope is that it will allow everyone to see that reaching out and benefiting from additional support is natural, important, and makes a difference in our lives. Now I'm pleased to introduce Joe Dumlau, who apparently has a budding barber in his family, so kudos to his 13-year-old from the Veterans Outreach Center.
Thank you. Good morning, everyone. My name is Joe Dumlau from the Spokane Vet Center. I'm a veteran myself. I'm also an outreach specialist, an EMDR therapist, and a counselor. I want to thank the opportunity to come talk about the Vet Center, as we are part of the Department of Veterans Affairs, but we are a separate agency from the VA hospital, and we are located at 13109 East Marabou Parkway in Spokane Valley. Our phone number is 509-444-8387. Vet centers are community-based counseling centers that provide a wide range of social and psychological services, including professional readjustment counseling to eligible veterans, active duty service members, including National Guard and Reserve components, and also their families. Readjustment counseling is offered to make a successful transition from military to civilian life after a traumatic event experienced in the military. Individual, group, marriage and family counseling are offered in addition to referral and connection to other VA or community benefits and services. Vet Center counselors and outreach staff, many of whom are veterans themselves, are experienced and prepared to discuss the tragedies of war, loss, grief, and transition after trauma. During this pandemic, if you feel that this is affecting your mental health, please do not hesitate to give us a call. We are accepting new clients. We are seeing clients virtually. We're also talking to them via telephone, and in extreme emergency cases, we will see them in the building. And I will bring up next my coworker and colleague, Robert Sturdevant. Thank you very much.
Thank you, Joe. My name is Stu Sturdevant. I'm a retired Air Force, and I've been with the Spokane Vet Center since the last 10 years, since 2010. I'm the Veteran Outreach Program Specialist and the Mobile Vet Center driver. The Mobile Vet Center of the Department of Veteran Affairs provide readjustment counseling and information resources to the veterans across the country. Like community-based vet centers, mobile vet centers focus on services that help veterans make a difficult transition between military and civilian life. Our mission is to help combat veterans readjust to society after combat, or to help those suffered from military sexual trauma, and to come alongside families who have lost loved ones in the line of duty. The Vet Center's mobile unit, whose mission is to take our services to the veterans in rural communities who otherwise would not receive the services they've earned. We have a catchment area of 35 counties in 4 states. Our mobile vet center here in our community, we cover this side of the Cascades of Washington State up to the Canadian border, past Tonasket, Omak, Republic, over to the Libby, Montana. And we also go as far as east as Silver Valley and the Wallace, Idaho, down south, Moses Lake, Lewiston, and we touch the corner of Pendleton and Hermiston, Oregon. So We partner up with different community resources too to better help the communities win. This last week we've been partnering up with Second Harvest, heading out to rural communities, providing veterans resources and food, to help those. So that's all I have. Thank you very much.
Good morning. My name is Rudy Lopez. I'm the director of the Washington State Veterans Cemetery, and also it's my privilege to be with you all here this morning and to share a little bit about what your Washington Department of Veteran Affairs is doing. We'd also like to thank the mental health providers and professionals that are out there during this month of recognition. And our agency also hosts those services under a different name, the Counseling and Wellness Program. And we're here to complement and work with our partners with the federal VA. We have a wide array of services that we offer, and we are partnered very closely with the federal VA to offer those services. We have 4 long-term care facilities, 2 on the west side, Ording and Retzel, and 1 in Walla Walla, and 1, as you know, here in Spokane. And they're here to serve our veterans in their time of need, to be able to provide for those care and resource needs that they have. We also have a state veteran cemetery here in Medical Lake. It is the only grant-funded state facility in Washington, and we're here to provide the burial benefits that our veterans earn. And that is our mission, to serve those veterans that have served and provide them and their families with the benefits and access to those benefits. And I'm here to tell you that your Washington Department of Veteran Affairs has worked tirelessly through this entire situation, which is very trying and challenging at best, and has not sustained or halted any of the services throughout. For our facility, the burials, they have not stopped at all. We've been able to continue to conduct interment services. What's new is, or what has changed during this period, is we've not been able to hold large gatherings. So as a result, families are limited to small services, no more than 10 immediate family members. And probably the most significant portion of this is military honors have been suspended throughout this period. Those will resume. We have confidence that in the near future, those will be provided available to those families. And for the families that have gone forward with interment services without military honors, we will give those families the opportunity to come back and honor their loved one with the dignity and honor that they have earned and deserve. The other program that we have here in Spokane is a regional veteran service center. It is a joint partnership between the state VA, the Washington Department of Veteran Affairs, county officials, and WestCare. And they are on Evergreen. They're here to serve and assist veterans to connect to all those benefits that they have earned. They're located at, and if you'll excuse me, they're located at 1117 North Evergreen Road, Suite 2 in Spokane Valley. During this period, they're teleworking, so the best means of contacting them is by calling 509-344-9280 or 509-344-9353. Or you can send your email request to vetstudy@SpokaneCounty.org. That is vetstudy@SpokaneCounty.org. And many of our offices are functioning in that capacity, teleworking or working through the challenges of the face-to-face contact. For the cemetery, we're instructing families to utilize their funeral service provider to help them transfer those documents that we need to be able to determine eligibility and move forward with the interment process. At this time, we're not having any clients come into the office and provide that face-to-face service. And I would like to mention that we just this week received word that we received a $1.6 million funding through the CARES Act to support our supportive services to veterans family program here in the Spokane region. If you have questions, we are here to serve those needs throughout this entire region and during these trying times. You can reach us at 1-800-562-2787 2308. That is our call center in Olympia, and they can redirect any of those calls. Once again, that's 1-800-562-2308. Thank you.
Thank you. My name is Heather Bain with Washington Department of Veterans Affairs. I'm currently the Traumatic Brain Injury Program Specialist for Eastern Washington, so this side of Snoqualmie. Currently, I serve all traumatic brain injury requests that come in through our agency here locally. I've been teleworking for the past 8 years, so in this trying time, everybody kind of learning how to telework. I was currently teleworking, so this is kind of nice that we can kind of get this information out to our community regarding traumatic brain injury. Currently, I also manage a program that is located on all of our university campuses here in Eastern Washington. And we currently have a navigator that are teleworking from home to serve veteran students. And my contact number to get a hold of those folks is 509-844 or 828-0449. Again, it's 509-828-0449. And my phone number or my email address that I can be located at is heather.bahme@dva.wa.gov. And I can get you in contact with a local navigator on a college campus that either you're associated with or have GI Bill questions or regarding traumatic brain injury, and I can get you contact for other resources within our community that will help serve those traumatic brain injury veterans that are in need. But we're all available, like Rudy said. We're all here to serve, and we can all be contacted at the number provided. Thank you.
And we have some questions for our speakers, and whoever's going to be the best one to answer these, feel free. We have a question on the current COVID-19 caseload and some of the challenges right now that the VA is seeing dealing with those.
Yeah, thanks for the question. My name is Sam McComas. I work at the VA Medical Center. I'm the Chief of Quality, Safety, and Value. That's my regular job there. And then since mid-March, I've been part of the incident command team related to COVID-19. So some of the impacts at the medical center here at the VA in Spokane are when you first arrive at the medical center, you'll see that the entry is kind of narrowed down to one spot. And we have what we're calling a checkpoint there, where people are simply asked what their purpose for their visit is. Or they're visiting if they have an appointment or they need unscheduled care. And then when they enter the medical center, everyone is screened. And many of us have seen those screening stations at other places, other medical centers in the community. There's some, you'll encounter some staff there who ask you a few questions about symptoms. They take a temperature and then send you to the right place in the medical center. So as far as what the impact is right now, like Brett said earlier, we've got 30 or so patients who are in what we're calling our COVID unit. And those are all patients who are transfers from the state veterans home. And we are caring for all those COVID positive patients in our what was traditionally or previously was our community living center or our long-term care facility. So actually our long-term care facility patients have been located in a different place on the medical center campus, and we've turned that into our COVID unit. One of the nice things about that is while it's on our campus, it's a little isolated, and it has it's easier to control access there, and it's an isolated place away from the other parts of the medical center, which makes it great for a COVID unit for isolation.
And what are some of the long-term expectations at this point?
Yeah, so timelines, of course, we're not sure. This is all about getting the patients the care they need. So we don't know. I think along with everybody else in the world and in the community, we'd love to know when this is going to be over, but we don't know yet. So we are working very closely with Department of Health, Dr. Lutz and others, and the state and, of course, the country about what that recovery plan looks like. We're working on what those criteria would look like before we're able to open up. Many of that's been shared over this pulpit, so we've talked about that, and we're in concert with that. But we are doing everything we can to make sure that patients get the care they need for as long as they need it.
Our next question would be for Rudy, if you could take the podium. Rudy, you had mentioned that there would be a resuming of services for families to honor their loved ones. Could you provide a little bit more explanation on how that will be rolled out? Will the individuals who missed that opportunity for those services in the last 2 to 3 months, will they be given first priority for when things do resume, or how will that rollout take place?
Thank you for that question. Yes, we've maintained a list of all the families that were directly impacted because they had services scheduled and had to have those changes made because of the circumstances. So they will be given the first priority. We will reach out to those individuals based on the date of schedule, and we will work with them. Some of those families have already told us that they opt to delay until a much, much later date because they have family members that are going to be traveling in from out of state, and those family members are at risk. So we anticipate working through those about 60 to 70 cases early on, and we know that we'll have plenty of capacity to not only serve those families, but to continue with the ongoing burials that are coming up as needed. And I failed to mention our contact information for the cemetery when I was up here. So direct calls, 509-299-6280. Once again, 509-299-6280. Or you can reach us at cemetery.va. I'm sorry. I should have had that one on the top of my head. cemetery@dva.wa.gov. That's cemetery.wdva.va.gov.
Our next question will be for Stu. Stu, with today being Giving Tuesday, I think we have a lot of members in our community looking for ways to contribute or volunteer or even provide their talents to causes in the inland Northwest. If somebody's looking to provide some kind of giving opportunity to vets, what would be your recommendation for them?
Well, there's a couple. To actually be a volunteer to help out the Spokane Vet Center, all our volunteers have to go through the VA Hospital Voluntary Services, the Chief of Voluntary Services, James Dean there. They have to be go through those guys, and they can ask where they want to volunteer at, the VA or the Spokane Vet Center. We take volunteers to help out, answering phones and all. To help with the community, we have a small food bank ourselves. We take donations for food to help veterans in need. At this time, there's a lot of veterans out of work, so one big resource is food. So donating food. We also have a donated account we can do, which is online through the VA hospital. So I hope that answers your questions. So.
Rudy, we have another question for you. This is in regards to, with it being May now, Memorial Day is right around the corner. For those that are looking to honor our service members on that special day, what kind of advice or counsel can you give for what might be some of the options?
Thank you. And unfortunately, this year we will not be hosting an annual Memorial Day Remembrance ceremony. It is the community's largest, with about 2,000 people attending. So this is a big gap, if you will, that we're working hard to fill that gap. I have verified that the National Memorial Day Concert will proceed this year. It's going to be done remotely, so a lot of the performers will be recording their performances and bringing those together, and we will be getting that information out to the entire public statewide through our media sources, and that will occur on Sunday, May the 24th in the evening on PBS channels. And in the interim, we are working with some local videographers to put together some local Memorial Day remembrances so that we've got a way to at least acknowledge and remember together to the extent that we can. Thank you for that question.
And the next question will be for whoever is able to answer it best. Can we talk about the support for homeless veterans right now here in the area?
Sure, I can speak to that. I think it's hard to start with what we're doing. I have a great group of staff that are stretching themselves every day to reach as many people as they can. I think one of the things I'd like to highlight is tomorrow, one of our staff members from the Healthcare for Homeless Veterans group will be going out with Second Harvest and delivering food to veterans at their homes or in areas where we can find them to make sure that they have some resources. We have our Healthcare for Homeless Veterans clinic in downtown Spokane that's providing services in person when necessary, but also we're finding creative ways to reach them virtually. We have some great technology that we're using so that we're trying to keep ourselves distanced, but also provide the services to the people that need it.
Our next question will be for Kelly. This is a question from a viewer right now. Are all COVID-related deaths reported in our county's 20+ number, or are those limited to the hospital deaths?
Yes, all deaths that take place at the Veterans Medical Center, as well as all of our hospitals, and any deaths that would happen to occur outside the hospital are included in our total death numbers. So, yes.
Follow up to that, that includes the nursing facilities as well, correct?
Yes. Anyone who passes away because of COVID-19 would be included in our death count.
Well, we appreciate everyone being with us here today, especially our speakers, and thank you for joining us here on Facebook. We'll see you again tomorrow.